Have you ever wondered how doctors can detect hidden antibodies in your blood before a blood transfusion or during pregnancy? One of the most important tools they use is something called the Indirect Coombs Test. This test can literally save lives by preventing dangerous reactions that might happen if your blood comes into contact with incompatible antibodies. In this video, we're going to break down exactly what the Indirect Coombs Test is, why it's done, how it works, and what the results mean, all in simple and easy to understand terms. So stick with me until the end because you're going to walk away with a crystal clear understanding of this life-saving test. Let's start with the basics. The Indirect Coombs Test is a blood test that looks for antibodies in the plasma, that's the liquid part of your blood, that might target red blood cells. Now, why does this matter? Because if you have certain antibodies floating around in your blood, they can attach to red blood cells during a blood transfusion or during pregnancy if the baby's blood type doesn't match the mother's. This could cause the immune system to attack those red blood cells, leading to serious complications. So essentially, the Indirect Coombs Test acts like a security guard, checking whether there are any antibodies in your blood that could cause problems later. Now, you might be wondering, when would someone actually need this test? There are three main situations where doctors rely on it. Blood transfusions. Before you get blood from a donor, doctors need to make sure your body won't reject it. The Indirect Coombs Test screens for antibodies that might attack the donor's red blood cells. Pregnancy. This test is often used during prenatal screening, especially for mothers who are Rh negative. If a mother has developed antibodies against Rh-positive blood, those antibodies can cross the placenta and harm the baby's red blood cells, leading to a condition called hemolytic disease of the newborn. Pre-transplant testing. In some cases, before organ or bone marrow transplants, doctors may also use this test to check for antibodies that could interfere with the procedure. So, in short, the Indirect Coombs Test helps prevent dangerous immune reactions in transfusions, pregnancies, and sometimes transplants. Okay, let's get into the science of it, but I promise I'll keep it simple. Here's how the Indirect Coombs Test is performed step by step. A blood sample is taken, and the plasma, that's the part of the blood containing antibodies, is separated. That plasma is then mixed with red blood cells that have known antigens on their surface. If your plasma contains antibodies against those antigens, they will attach to the red blood cells. Finally, the Coombs reagent, also called anti-human globulin, is added. This reagent binds to any antibodies that are stuck on the red blood cells, causing visible clumping, which we call agglutination. If agglutination happens, it means antibodies are present. If there's no clumping, then no antibodies were detected. Now, here's where people often get confused. What's the difference between the Indirect Coombs Test and the Direct Coombs Test? The Direct Coombs Test looks for antibodies that are already attached to your red blood cells inside your body. The Indirect Coombs Test, on the other hand, looks for free-floating antibodies in the plasma before they have a chance to attach. So think of it like this. The direct test asks, are your red blood cells already under attack? While the indirect test asks, do you have antibodies that could launch an attack in the future? Okay, so you've had the test done. What do the results tell us? Negative result. This means no antibodies were detected. That's generally good news. It means blood transfusions are safer, and in pregnancy, it means there's less risk of complications. Positive result. This means antibodies were detected. In transfusion cases, the doctor will need to find compatible blood that doesn't trigger a reaction. In pregnancy, it may mean the mother has developed antibodies against the baby's red blood cells, and the healthcare team will monitor closely to protect the baby. It's important to remember, a positive test doesn't always mean something bad will happen, but it signals to doctors that extra care is needed. Let me give you a real-world scenario. Imagine a patient who needs a blood transfusion after surgery. Without the indirect Coombs test, they might be given blood that looks compatible at first glance, but actually triggers their immune system to attack. That could lead to a severe transfusion reaction. Or picture a pregnant woman who is Rh negative, carrying an Rh positive baby. If she has developed antibodies from a previous pregnancy, those antibodies can cross the placenta and start breaking down the baby's red blood cells. By using the indirect Coombs test early in pregnancy, doctors can catch this risk and manage it with treatments like Rh immunoglobulin injections to keep both mother and baby safe.
So let's quickly recap what we've learned. The indirect Coombs test checks for antibodies in your plasma that could attack red blood cells. It's most commonly used before blood transfusions and during pregnancy. It works by mixing plasma with test red blood cells and using a reagent to detect clumping. It's different from the direct Coombs test, which checks for antibodies already attached to red cells. The results guide doctors in preventing dangerous immune reactions. Simple but powerful, right?
And that's the indirect Coombs test explained in an easy and straightforward way. This test might seem small, but it plays a huge role in keeping patients safe during transfusions, pregnancies, and more. If you found this video helpful, make sure to hit that like button and subscribe for more medical and health explanations made simple. And if you have any questions about the indirect Coombs test, or if there's another medical topic you'd like us to cover, drop a comment below. We're here to help, and we'd love to hear from you.